So I do get commonly asked about robotic surgery, and for me, robotic surgery is, I think it's interesting. It's coming along. I think we're going to be having this discussion in another decade. I think right now, I always have found that I can perform better than the robot can in terms of the final clinical result if I judge it by radiographic appearance. So in my hands, it hasn't made a whole lot of sense. I do use computer guidance, which I have adopted early, and that was to improve over the classical overlays, which I used to draw on the x-ray and do overlay techniques to make sure I'm getting things correct in terms of the length, reconstruction of offset. I believe that some of these computer navigations make that much more facile, but robotics at this point haven't been able to beat my own hand, and because of that, I haven't adopted them.